Hello, I'm Dr. Jodie A. Dashore, and welcome back to BioNexus Health Clinic podcast series. Before we proceed, I have a request for all of those watching this episode. If you could please subscribe to the channel, it keeps the staff motivated to produce more episodes for you. It has been brought to my attention that about more than 56% of those who are watching our podcasts are not subscribed. So please, if you could subscribe, it would be awesome. I would really appreciate that. Okay, so coming to today's episode. Today we are speaking to Vinayak from New York. Vinayak is a father and a husband, and he will be discussing his experiences and his journey with his little son, Arish, and his wife, Ambili, both of who have had severe symptoms after being exposed to mold at their residence. Now, what Vinayak did not know when he first approached BioNexus Health was that there might be tick-borne infections coming into play as well. So upon further investigation, we found Lyme disease and other tick-borne infections, along with several comorbid infections as well. And once we discovered these, started treating with completely natural herbal protocols, we have seen pretty good results. In fact, downright amazing results in some aspects. And Vinayak has been kind and generous enough to say yes to sharing his recovery story for his family with us today. Now, a point to note is Vinayak himself is a health coach, is quite knowledgeable about herbs, Ayurvedic, and naturopathic treatment options. That's what he prefers, I believe. And there's another point to note is that Vinayak did not really experience a whole lot of symptoms himself that he wasn't able to take care of on his own. Now, when it came to his wife and his son, it proved to be a difficult challenge to overcome, and he sought out my assistance with that. So let's welcome Vinayak to the show.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in Integrative Medicine, is board certified in Integrative Pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Dashore.
Hi, Vinayak. How are you today? How's New York today?
I'm doing good, Dr. Dashore. Thank you for asking. Yeah, the weather is turning a little cold in the mornings, but all good so far.
Yeah. Good. Exactly. Same here in New Jersey. Looks like fall is definitely in the air, right?
Right.
Yeah. So today, the purpose for today's podcast is that you have kindly agreed to speak about Arish and your wife Ambili's pretty good recovery from mold, biotoxin illness, tick-borne infections, right? So if we could perhaps begin at the beginning, can you tell us how did you become aware? Like when did your son's health problems start? He was never really diagnosed on the spectrum, but you being a health coach and a knowledgeable practitioner yourself, you had your suspicions, I think you had mentioned.
Yeah, so Arish was born premature and he had delayed milestones. So I was on top of things just because of that situation. And subsequently, I think he went to his pre-K school, and I think that's where my suspicion is that he might have got bitten. But unfortunately, as in a lot of cases, I didn't see any classical bull-eye rash. And subsequently, his health started going down, as in his energy levels, his attention, those things kind of started dropping off. And that's when I thought, okay, there's something more to this than just the preemie part of it, right?
Oh, I see. Okay, so you're saying that during pre-K he might have had a tick bite.
Yes.
But you never saw bullseye, right? So did you suspect any kind of high functioning autism or mild autism going on at that time?
Kind of, because I think during that age, it also coincided with his vaccination schedule. So
Right.
there was never a clear-cut kind of thing which I could lay my hands on. So I was thinking more like it could be a combination of all of those things.
Right. Okay. So it was in pre-K itself that you started seeing symptoms like neurological symptoms, right? Concentration, focus. Did you
Right.
say language? Okay.
Yeah, language delays, essentially language. He's good in math, but I think it's just the comprehension and the language processing skills which got affected, right?
Okay. It's quite interesting because many parents of children who have high functioning autism or Asperger's, um, or if they have mild autism, or if they are on their journey to recovery from autism, the one thing, and myself included, what we see is very similar to what you saw, is that mathematical concepts and actual computation seems to come faster versus understanding the word problems, as well as with language, right? Understanding, listening comprehension, reading comprehension. Vinayak, you'll find that interesting. Now, Arish is not there yet, but he will be in high school, in a few years. And what's interesting is that, again, my son included, is that the SATs, because this came to me right now because yesterday I was speaking to another parent, and her daughter, she has it in her head, she wants to do medicine, and she wants to go to Johns Hopkins because mom is from Johns Hopkins, so she wants to do that. But interestingly enough, she's fully recovered. However, with the SATs, right? Math, perfect 800, right? She did the chemistry subject test, perfect 800. But with reading comprehension, that's where, she was like around 720, 730. And she tried like 2 or 3 times. But that seems to be something that is pretty slow to recover. Even kids who are more or less, functionally more or less fully recovered from autism or chronic illness. So
right. I think that requires that understanding, that subtlety, which is not very obvious. Right. So math is very obvious, but ELAs are a little more subtle, right? So I think that's where that jump needs to happen, or that neurological impact is there. Yeah.
Correct. Yes. Yeah. So please proceed. So what did you do next with your son?
Yeah. So I, as any parent would do, go to the pediatrician, check him out, kind of voice my concern that this might be an issue. Because I think during one of those times we had to go to the ER because he had high fever and things like that, and the doctor in the ER kind of said that Lyme word. I said, I don't even know what that is, and that I said, okay, I am going to pursue all threads of investigation, and which is what I did. And then I saw, so this could be a problem, and when I went back to his nursery, and that's where I saw that kids were playing in an area which was usually visited by the deers. So I could connect that dots that maybe this might be a plausible reason or cause for it. So that's how I kind of started there. Then I visited the pediatrician. I voiced my concern. I insisted upon them to do the CDC, at least the CDC, of course, which they refused. Then I convinced them to get the IGNX test done, and which is where we actually could see the DNA parts of the Borrelia pathogen, and that's how I could confirm. Next step for me was to try to do something not antibiotic, but the pediatrician kind of anyway gave him a 3-month or 2-month course of amoxicillin, and we did. And I think that again had some impact because it just destroyed his gut flora. So I think that's how I also kind of started getting into that space. because it was getting out of control, right? And there is someone who needs to know, as a parent and as a subject matter expert, kind of to keep it in control. So that's how it went. Next, I reached out for some kind of alternative medicine. So I did the Cowden protocol for maybe 6 months, and I thought that he kind of went into remission for a bit of period, and that was probably around first grade, yeah. And he did very well there in ELA. He was doing well. His vocabulary was all good, and then he regressed again, possibly because I stopped thinking that after 6 months everything is done. And that's how it kind of led there. And then I picked up my credentials, and then I thought, okay, let me do myself something. I tried my best with whatever information and knowledge I had, but no clinical experience. I think that's where I said, okay, now I need some expert who has that clinical wisdom, right? And that's the differentiator there, and which is where I found you. And I said, okay, this is the right practitioner whom I want to approach to, because she's doing herbal, so there's no conventional antibiotics, and then she has all this holistic and integrative approach, and she has been through as a mom the same journey that I am going through as a dad, and my wife as well. So which makes all the most sense, because now it's like the problem is in-house and you live it every day, right? So I said, Dr. Dashore is the way to go, and that's how I reached out to you.
Oh, okay, I see. Yes.
Yeah.
Well, I'm glad you did.
Yeah. And there was one other kind of twist to the story as well. During this time, we moved to an apartment. We stayed there 4 years, and the first 2 years were fine. The next 2 years, I realized it was a water damaged building, because the basement got flooded, and there were no obvious signs of mold.
Wait. I'm sorry. I'll stop you right there. So because I have a question.
Sure.
So in the beginning, you found Lyme, you did hygienics, and you did antibiotic treatments, and then you were told, and you also assumed that it was gone. Lyme had been treated.
Right.
No one looked at co-infections.
Right.
So you were like, all right, Lyme's gone. Then you moved to another apartment.
Mm-hmm.
Okay. Now, when you moved to this water damaged apartment, how old was Arish?
He was maybe 5.
At that time, he was just 5 years old.
Okay.
Yeah. Okay. All right. So please proceed.
Right. So the first 2 years were fine. I think in the third year, I think there was a heavy rain and the basement got flooded and backed up. And being a little old house and apartment with wooden structures, I think that's how the water damage started kind of showing up. And we thought, okay, it's just water, it's got drained and everything is fine. So, I mean, there was no obvious visible mold, right? So, because typically people will associate mold with this black spot or whatever, but that's not the case. And which I learned is you have different kind of molds, visible, invisible, and they have their effects, visible, invisible. So just because you don't see does not mean it's not there. So yeah, and that again had an impact on his immunity. He would have headache every day. He'll go to school, eat his lunch, have stomach pain. So either he won't eat or he will have headache. So not just that his academic performance was suffering, but his actual health was also suffering. And I said, okay, I did the Lyme thing. It's gone now. What's new? And then I went on to this mold discovery journey, and I thought, okay, this is an additional problem. And unfortunately, both are biotoxin illnesses, have neurological impact. And that's how I said, okay. And I think during that journey is when I started reaching out to you.
Yes. So we looked at Lyme disease again. We investigated Lyme disease. We investigated co-infections this time.
That's right.
And then, like you accurately said, that Lyme disease secretes biological toxins. Co-infections also secrete toxins. Mold secretes mycotoxins, which overall contributes to biotoxin illness.
Right.
And Now, Arish was not gaining weight. He was not thriving. He had his immune system appeared to be weak. You mentioned headaches and stomach aches every day. So we, after running a lot of testing to look at how different systems were functioning, we started a completely herbal protocol, right? So how did you find the BioNexus herbal protocol to do, hard? Was it manageable? Were you able to fit it in your schedule? And what improvements did you see one by one?
That's right. So what I liked about the way you do things is you calibrate and tailor it to each individual, right? Which is what every doctor should be doing. But that's not the case, unfortunately. So based on Arish's symptoms, his co-infection, and the lab reports, you customized his protocols, and they're pretty easy to follow. So you had laid out all the regimen, how many drops, and how to calibrate it, right? Based on if he is going to have a Hertz reaction or not, and what to do if there is a Hertz reaction, when to take the binders and things like that. So that was pretty easy that way for me. Yes, and sometimes the times will be a little here and there, but I don't think that was a big issue.
Well, that's really good to hear, because with so many chronic issues going on, and when we are speaking about helping the immune system, helping the brain, you need to understand that, first of all, if you're going all natural, because allopathic medicine doesn't have answers to chronic issues, in my experience, I think in your experience as well. So it will require customization, individualization, custom tailoring to the patient. That is the best approach that I've found over the years. It all started with Brian, as you know, with my son, to try and find the optimal approach to recovery from so many chronic issues. Now, symptom-wise, what symptoms did you see starting to get better?
So his a very obvious ones were headaches started going out. So now, touch wood, he pretty much doesn't have any headache. No stomach ache. His shin bone used to pain. That's no longer there. He's thriving much better. I mean, you can see the difference in your kid when he's not thriving versus when he's thriving and he's full of energy, right? And which is what all parents would want to see. So yeah, I think that's where I thank you and your approach to get him at this stage and continue his journey to complete remission.
Oh, absolutely. It's a blessing and a privilege to be able to help another human being. It's just, it is. So I'm glad we were able to help him. So he's thriving. He's doing well academically. He's growing.
Right. He's gaining weight because he was more on the skinnier side, being a preemie and all of that, but he's kind of overcoming that. I think his language, his vocabulary has improved tremendously. He was shy as well, very shy, reserved. Very quickly he would get overwhelmed by a lot of stress, right? Both mental and physical, which kind of is going off, right? So he's playing a longer times, and he's able to take the stress of the studies and the physical stress. So which shows that he's heading into the right direction. He has that resiliency building up in his body. Yeah.
Wonderful, wonderful. That is so nice to hear. All of the people watching this episode will get a tremendous amount of hope that going completely natural without any strong medicines or antibiotics, which you tried, which I tried as well, unfortunately, in the beginning, right? Because when you see, oh my God, infection, you're like, it's really affecting my son's brain, his body. We need to get rid of it. But it becomes important to also consider other options.
That's right.
Right. Yeah. So let's talk about your wife.
Mm-hmm. Yeah.
So if you can tell us, obviously she was exposed to the environmental exposure to mold as well. And then she has other chronic issues that we started treating. So if you can talk a little bit about Ambili and, what brought you to have her start treatment as well.
Right. For Ambili, it was like, I think 5 years back when the issues all started cropping up. And in retrospect, what I think is it started with a stomach infection or some kind of food poisoning. That was the initial trigger, I believe, and I think probably that messed up her gut in some shape or form, and that continued, and probably the symptoms were not great enough for us to treat or reach out for help with a doctor, and probably that festered, right? And then I think around that same time we went into this new apartment where there was mold damage as well. So I think just that a lot of immune burden started piling up. Right? And that's when she started having a lot of arthritic pains in her elbows, small fingers, knees, back, lower back, fibromyalgia, brain fog, a lot of neurological symptoms is what started affecting her. She had almost zero energy. There were few days where she couldn't get out of the bed and do anything. So it was a very tough time for all of us during that time, just because Arish was also having getting affected with Lyme and the mold, and my wife as well, and possibly me, but probably based on different genetics and whatever, I have probably a little more resilient physically. So that's how I think Ambili's situation was. And then again, same thing. I said the way to go and treat Ambili would be the same way. I didn't want to pursue the mainstream approach, and then that's where I reached out to you again, along with Arish. I said, okay, both of them, let's go to Dr. Dashore. Yeah.
Yes. Now she has shown improvements. I know because she had pretty severe problems, and we were initially focusing on your son as well, because overall she was managing as an adult.
Right.
But she has shown improvements as well, hasn't she?
Right. Yes. So she also has that same kind of pattern where she used to not get sleep, apart from all the other pain and fibromyalgia, brain fog. She wouldn't get sleep. She would wake up with a headache, and then the whole day is ruined, and she does not have energy. She actually had to take kind of a short-term disability, and eventually she had to leave her job for 3 years. That was the kind of impact that she had. Slowly, as we started your treatment protocol, her headache started going away, her brain fog kind of started lifting, the pain went down, the inflammation went down. There were some situations where it sometimes, because possibly some small exposure of mold in the food or somewhere, would re-trigger some things, and there would be a little bit of flare-up. But overall, it was day and night difference between before starting your protocol and after starting your protocol. So yeah, and based on your protocol where you focus on binding that biotoxin and eliminating it, that's the key, and then trying to help the immune system and the body with all your medicinal herbs and herbal protocol. So, and rebuilding the body, I think that is what you want. You want the bad stuff out and generate the new thing and help the body regenerate itself. So yeah, I think she's also on the path of recovery.
Wonderful. See, that is, having your wife and Arish's mother on the mend is a big deal for the family. It helps to keep everyone motivated.
Right.
Right. It keeps everyone happy and moving forward in that way. So I'm really glad that Ambili is on the mend as well. Yeah, and I'm actually I'm most glad about you having had mild symptoms, and you managed your own health very well overall.
Right.
Yes.
Yeah, and being in the family now, it has become our kind of mission to make sure that we collectively do the right things, eat the right food, follow the protocol. So those things also started helping, right? So it's all those small differences that add up to make the change and help the body and tip the balance, right?
Yes. One thing that I've observed, everything you said, I agree with about diet, whatever you just mentioned. It's overall lifestyle overhauling
Right.
of the lifestyle, and many families kind of tend to stick with this healthier pattern with the diet, with the stress levels, managing stress levels, being able to say no to people, being able to delegate properly, not taking too much on yourself, because we know that if your immune system becomes run down again because you are either a people pleaser or trying to keep up with the Joneses, so to speak, then your health can tank once more. So one important thing for my family as well was a beautiful spiritual maturity that comes from going through chronic illness with multiple family members. You just kind of calm down. You're like, okay, tomorrow we'll see what happens tomorrow. Let's make sure today is beautiful, and so on, right?
Yeah, I mean, it changes your perspective. It actually re-baselines your approach towards life, right? Because it's like it's a kind of a good knock on your head saying, okay, wake up and get your bearings right.
Right.
Yeah.
Yes. And it's important to be grateful for getting health back. Not many people, there are many people out there who are not able to recover from chronic illness, for whatever reason, but they are not. And one of the most important reasons is that people around the world are not aware that other than conventional medication, that there exists this whole other arena of natural medicine, which has a wealth of plant-based treatment options that are very effective.
Right.
It's just, people around the world are so used to pills and tablets and what have you, that they have forgotten ancient medicine.
Right. I mean, I would like to add something there as well. Right?
Yes.
So mainstream medicine gives you pill, and people reach out to do the quick fix and move on in their life, which is justified, right? But I think what everyone needs to be aware of is you're not addressing the root cause. All you're doing is addressing the symptoms. And what the herbal approach or integrative approach that Dr. Dashore does is actually addressing the root cause and enabling the body's natural healing mechanism to kick in and heal yourself from inside out. So that is the key, right?
I love that you said that, that looking at the root cause, because yes, that's what I like to say is I practice root cause medicine. That's something, and there are many naturopathic physicians and herbal medicine specialists in many different cultures, many different countries around the world, especially United Kingdom, Scotland, Ireland, of course, India with its huge Ayurvedic and Siddha medicine principles, and Africa, right, Eastern Europe. I have patients from what now? I think 62 countries now, and I've seen that local herbs and herbalists do exist, but what happens is, because of lack of awareness, right, people don't approach them.
Right.
And even in the Caribbean, Jamaica has a wonderful history of using herbals, and as we know, Jamaica has a very large Indian population which had migrated there many years ago, right, during the British times. And and I think, it is in the islands, it is a beautiful amalgamation of Ayurvedic herbals plus whatever medicinal herbals are available on the islands themselves. So that's, yeah. So I actually find, Caribbean people in New York as well, they have their own herbal apothecaries and natural medicine shops as well, right? Yeah.
I think that's how the different cultures kind of mix together and further evolve the medicine and cater to that local issues, local problems, local solutions, right?
Yeah. Right. Yes. And I know both of us don't mean to trash allopathic medicine. It's just like it's good to have, like you mentioned, a broader perspective that what is more sustainable long term, doing herbal tinctures or doing antibiotics for 4 or 5 years. So that is just sometimes I like to say, it's more or less a common sense approach that obviously doing plant-based treatment options are more sustainable long-term. And, if you get any acute problem, obviously you need to go to the ER, you need to use allopathic medicine for trauma and acute care. It works really well.
Wonderfully, right.
Wonderfully well.
Yeah, the allopathic medicine has its place.
Yes.
It's not that it does not have, it has its place. It's just you need to identify as a patient and between your practitioner which approach you want to do and what's your problem that you're trying to solve. Yeah.
Right. Yes. Yes, exactly. Now, on that note, I would like to bring us to the conclusion of today's podcast. And I'm very appreciative of you sharing your opinion, your knowledge, your perspective. One of the reasons I invited you to the podcast, and fortunately you accepted as well, was exactly because of your keen observational skills, your educational background, your interest as well. Some of the nuances that you have picked up along the way, and you have enhanced your own career as well, right? With like naturopathic options. Wonderful.
Yeah. I mean, a home remedy is the best remedy, right? And then you reach out to allopathic care based on what your situation is, or integrative or holistic care. But yeah.
Right. Exactly. Yes, I couldn't agree more. So here's hoping to continued health and wellness for yourself, of course, and Arish and Ambili as well.
Yeah, we are grateful that there are practitioners of your caliber out there trying to move things and pay it forward and helping others, because apart from just being a profession, I think it's something of a calling as well, right? And you feel so grateful in helping others. So with my own credentials, I try to help my family and friends, and that gives immense happiness. And not everything is money just buys your material comfort, right? But that happiness is priceless, right? So yes, so we thank you and we thank ourselves that we found Dr. Dashore and she's so close to us, right? So we can always visit her in New Jersey.
Yes. Oh, no, absolutely. You are welcome. Like I said, it's been an honor and a privilege to help your family. I agree. One needs to pay it forward. It's a huge blessing to have the health of your child, your family members back. And it is a blessing and a responsibility to pay it forward, right? That's why, you and I are both taking time. Everybody's life is busy, so it's important to carve out time to help others. And you're here today helping spread the message. And it's important to do that. Exactly. It brings gratitude. It brings inner peace as well.
Yeah. And that's also part of your healing journey, right?
Exactly. Yes. Mind, body, spirit.
Yeah.
So I will see you again soon at your next appointment, I guess. And, Hope you have a wonderful day today. I know you have helped touch the hearts of everybody watching this episode.
Yeah, I thank you as well for giving me that opportunity.
All right, so that brings us to the conclusion of this episode of BioNexus Health Podcast Series. Thank you to all of those who tuned in. I hope it was helpful, useful, and educational for all of you watching. Now, once again, let me remind you to please hit the subscribe button so you subscribe to the channel. And I hope to see you at the next episode as well. Namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.